Welcome to the Fredrickson Health Show, highlighting expert practitioners from health, fitness, injury prevention, functional medicine, and integrative medicine. If you are into upgrading and optimizing your health, this podcast is for you. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here is your host, Dr. Robert Fredrickson.
All right, guys, welcome to another episode of the Fredrickson Health Show. Today, we're going to talk all about thyroid health, and in particular, we're going to talk about Hashimoto's and some natural treatment strategies to address this. Today, we have the pleasure of speaking with Dr. Omar Akhter. He's a board-certified internist with a private practice here in Austin, Texas. His practice is focused on holistic approach to chronic disease management. He completed his internal medicine residency in New York City and worked as a hospitalist in a large academic center in New Jersey before moving to Austin. He strongly believes in treating patients as a whole and incorporating aspects of functional medicine in his practice. He also serves as a board member of the American Holistic Health Association. And he also hosts another podcast called Better Medicine, which you guys should all check out. Outside of medicine, he has 3 young boys, which keep him very busy, as you can imagine. Dr. Akhter, thank you so much for coming on today.
Yeah, thank you for having me. Looking forward to speaking with you.
Yes, and it's been fun to be around you and to watch kind of your journey. And, we met in person, I want to say 3 years ago, and you were just getting your feet wet, if you will, into functional medicine at the time. And you were still working an emergency room shift, I believe, at the time.
Hospitalist shift.
Hospitalist shift. And it's been amazing to kind of see your, transformation, if you will, if you call it that, but just your journey into functional medicine. So just tell anyone listening, how you got in, why you got into medicine, and then how you found functional medicine and how you've kind of made this shift into more of seeing the patient as a whole.
Mm-hmm. So I came from a family of doctors, and both my parents were physicians, and a lot of my aunts and uncles and even cousins, older cousins, were physicians. So in a way, it was really all I knew. And I was the firstborn in my family. And so, growing up in Pakistan, where I'm from, you don't have undergrad. So you have to decide pretty early on what track to take. And you end up kind of deciding between a science track that primarily contains biology, chemistry, and those subjects versus more of a business and non-science route. So you pretty much have to decide that at the age of about 16 or 17. And wow,
that's early.
It's very early. And once you're done with about 13 years of schooling, you go straight into medical school as opposed to 4 years of undergrad over there. So it's a bit different over there. But that does mean that someone at the age of about 18 or 19 will go into medical school, probably about 19. And so, you have to really early on try to figure out where you're excelling in academically a little bit more. And then based on that, you'll choose your subjects and then apply to medical school that way. So it was almost like a no-brainer to me, just with my background, with my interest. I didn't really know what medicine was like or what my experience would be like. So it was going a bit into the unknown, but I had a lot of support around it and with my family. And so really decided to take that leap into it. It was almost like my destiny in a way.
Yeah.
And so that was the natural path carved out for me. And I got into medicine that way. And then I moved over to the States for internal medicine residency and working in a hospital system after that. But what really happened in that journey was, as I learned more about the inpatient world and the medical world as a whole on how it works, I just realized that there was something missing in my own satisfaction when it came to seeing patients, when it came to using a more holistic approach, using aspects of diet, lifestyle, and more of a deeper dive into patients. And when I felt that dissatisfaction, I looked to exit the hospital a little bit more and focus more in the outpatient world, where I felt like I could really help people and get down to the root of their issue. And so when we moved to Austin about 3 years ago, that's when I started this practice, and that's where we met as well, early on before the pandemic. So that was quite a while ago. It was a different world at that time.
Seems like forever.
Yeah. So So yes, it's been an interesting journey. It's been a lot of learning, I would say, after medical school and after residency, because a lot of what I'm faced with in the practice is not stuff that they teach you over there. And so I have a lot of chronic complex issues that I need to be able to work through in patients. And that happens when you continuously learn and just get better with experience.
Wow. So that I didn't know that you guys started school so early over there. So how old were you when you graduated medical school?
I was about 24 when I graduated medical school.
That's crazy. That's like when I started a chiropractic school when I was, I think 24. So you already
Yeah,
graduated,
because
you're
you don't.
done, and starting your residency. And how old are you when
Yeah.
you completed your residency?
I was about, I think 28 about 28 when I completed residency, because now bear in mind the medical school over there is 5 years as opposed to 4.
Oh, wow. So it's even
And
longer.
so
Wow.
it's an extra year. Plus in transitioning from over there to come here to do residency, you do lose a year in applications and completing your USMLE exams and stuff like that, because it's not like a perfect match where school ends there and you start here. So instead of 4 years, it's almost like a 6-year journey. So there is a couple of years so an extra year of high school and 2 extra years in terms of medical school and getting to residency here. So, but you still end up younger than the average student out of the medical school here.
Yeah, but still, you're graduating. I mean, 24 residency at 28. That's unheard of. I know kids over here that are starting school. Taking a 4-year hiatus. For whatever reason to work or whatever. But yeah, so you got an early start from the get-go, and that's amazing. So, did you know about functional medicine before? I know you, or were you searching for answers for why your patients, weren't getting better with the traditional medical model?
Yeah, I didn't know about functional medicine before. I knew deep down that there was more of a holistic approach, more of a approach where I could not tunnel into just one specialty or one system, but I didn't know what that looked like practically and what that's described as, until I came across functional medicine, which was more through people like Dr. Mark Hyman and other the more pioneers in this space. And I have a lot of respect for them and the amount of time they've been doing this and all the expertise and experience they have. So that was really my introduction into the world. And once you get into that world, then it's just one after another. You find more people, you find more resources, more books, more courses and things like that. So it's, the knowledge is kind of a daily type of thing to learn more and more, and then apply that on patients and get more experience.
That's awesome. And you mentioned books, and I think that's a question I get asked a lot is, what books did you first get inundated with, and what books would you recommend to others who maybe are looking to follow the same path as you? Maybe they're a clinician, maybe they're just a general health nut. What are some books that you recommend people get started with?
There's so many. So it depends really what topic you want to touch. I think that Dr. Hyman has a lot of good books talking about nutrition. He has one on blood sugar. He has one on the intersection between, it's called Food Fix, the intersection between nutrition and the way our political and other systems are set up and the interplay between them. If you want a more of an autoimmune, thyroid, things like that, Dr. Karazian, Datis Karazian is another one that has written a couple of books. One is on brain health, one is on thyroid health.
Thick books. Those were very thick books.
Excellent. Yeah, those were excellent. His courses are great. I've benefited a lot from him. And then there are folks in the field, physicians in the field of hormones as well. Dr. Sarah Gottfried has a book called The Hormone Cure.
Yep.
Dr. Uzi Reyes, Reiss, I believe. He has a couple of books that I have on hormones as well. So a lot of different people have written on different topics. Trying to think if there's any other books that come to mind. I have a whole bunch in my office.
I know you do. That's why I wanted to ask this question.
Yeah. Dr. Susan Blum has one on healing arthritis. which is great for rheumatoid arthritis and other arthritis conditions. So yeah, there's a ton of them. It just depends on what topic you're looking for, but you don't get taught a lot of nutrition or any functional medicine really in medical school. So a lot of these concepts are new when you come out of medical school.
Right. And you got out of medical school, I mean, I'm not going to say recently, but within the past 10 years, right?
Yes, 2013.
And so that I've always known that. And I've always, one of those things that I like to talk with clinicians about is, hey, like you're not taught this stuff in school, you know, well, where did you learn it from? Like you went to courses, you researched outside the box and you read the books, but what is it, an hour or two on nutrition? It's basically like just the macronutrients, carbohydrates, fat, and protein, and that's about it. Refer to a dietitian. Is that kind of, the gist of it, the Cliff Notes version?
Yeah, to be honest with you, I'm struggling to even remember specific nutrition courses, classes, anything that we had in medical school, and we really didn't over there. We over here, I think there's something like 8 hours in medical school given total to a United States medical student coming out of school here, which is very little. Over there, I'm just trying to remember even a dedicated class specific to nutrition, which I don't recall.
Right. And I think that's kind of standard for a lot of the schools here, and overseas. Is there's not a lot of nutrition, not a lot of focus on it. It's more pharmacology, emergency medicine, radiology, et cetera. But nutrition is kind of on the back end. But I think now we're seeing kind of the importance of it. And I know clinicians see the importance of it, and they're asking questions I've never been asked before ever. I guess the pandemic spurred a lot of that, but now I'm getting questions on vitamin D, magnesium, like, what's the best type of magnesium? And I can tell them, vitamin D, like we need a vitamin D. Why do we pair vitamin D and K2? So I'm getting questions that I never got asked before. And I think it's good because I think the doctor getting asked for the patients. And I think the patient and the doctor's now like, hey, I need to know this stuff because you want to have an answer. And so for you though, in your practice, and at first you started off as a direct model, and tell us about that and why you wanted to go direct, and then kind of the transition you've seen, I guess, in your own experience while opening up your own practice. Because I've seen you kind of transition, and it's been very cool to watch.
Yeah, I started as more of a direct primary care practice. And the reason to go into direct care, and what that means is that I don't bill any insurance and it's more of a cash pay practice, is that you aren't really then dictated by any third parties, whether they be insurance companies or they be, governmental agencies or anything like that. You really have the onus to practice in the freedom that you have as dictated by your license. And so I really like that model. It gives me the freedom to see the patient as long as I need to see them. I'm not rushed in a visit. I am not limited by the number of things I can talk about. So there's a lot of benefits by being outside of insurance, so to speak. And so that's kind of the direct model. I started off more in primary care on a subscription basis, and I've since evolved that to more of a fee for service because I've noted that not everyone has needs that are ongoing. Some people just want to have a very detailed initial visit and then may not have further follow-up needed. Other people need more follow-up. So I needed something that I could cater to both, as opposed to committing everyone into that same monthly model. And so I transitioned that slowly, and I think I've gotten to that right point where it's where I feel like the type of patients I'm looking to treat and help out are the type of patients that I'm getting. Not to say that I can't see anyone. I do take everyone and see everyone within reason, but it just meant that I'm trying to focus less on primary care and more on specific areas of focus. And because I do think that there is a lack of expertise in that area, and that void is something I'm trying to fill.
Yeah, and it's cool that you've just kind of evaluated your own practice and said, hey, we started off membership, and then you really said, well, maybe you're getting your patients better so much faster that they didn't need to come in as a membership model. So then maybe you say, hey, maybe a direct to fee to service is more applicable, because we know in functional medicine a lot of people get better, and they might not need you unless something pops up, and so then you can pay a fee. So in your experience, though, and I know there's a lot of different mindsets out there about this, but like people say we need to niche down, we need to find a patient focus, but we want to treat everybody, right? But then people still have the focus for like, hey, we specialize in maybe this subset of conditions. And for you, when we talked earlier, you said yours is more thyroid health and Hashimoto's. And was that something you wanted to start off with, or was that just kind of something that you started seeing your practice more and more and people started referring for those conditions?
Yeah, that's a really good question. I started seeing Hashimoto's more and more in my practice, and as I currently do, where people would either come in with a diagnosis or they would have those symptoms and we would find Hashimoto's because it is the most common autoimmune condition. And so, I was kind of faced with needing a better approach, not just for Hashimoto's, but for autoimmunity in general. I think there is a significant void because really what's going on is that all of these conditions are being treated by the specialist that within that the area that the disease occurs in. So your gastroenterologists are treating your ulcerative colitis and Crohn's, and your neurologists are treating MS, right? Endocrinologists are treating Hashimoto's, but there's no real autoimmunologist, if you will, right? There's no person that is really treating autoimmune disease as a whole clinically. You can argue rheumatologists, but they're also limited in what they're treating in like SLE, lupus, Sjogren's, things like that. But that one person that can understand the immune system from a deeper immune perspective, but also see the clinical implications of various immune system dysregulations, disorders, and then treat them. So I'm doing my best to kind of fill that void as best I can. And so it came from really just a need for the patients that I was seeing.
Yeah, so you're just seeing more and more people come in with maybe thyroid issues or maybe undiagnosed Hashimoto's. And can you tell people kind of what some of the tests that you run to identify Hashimoto's for someone who's maybe just doesn't know? Maybe they think they have symptoms of an underlying thyroid issue, but they've been to the doctor and they've been told they're normal. What would a patient do to advocate for additional lab testing to maybe see if they have underlying issues like Hashimoto's?
Right. So it's important for patients to know that conventionally they're tested with their TSH levels, and the TSH is a thyroid stimulating hormone, and it's actually not your thyroid hormone. It's the signal that comes from the pituitary gland down to the thyroid, which is the gland, the little butterfly-shaped gland in your neck, that stimulates the production of thyroid hormones, which are T4 and T3. And so that is the main test that's done. And on the basis of that, you're really put on thyroid medication if you're hypothyroid, or just told that everything is okay. But what we know about Hashimoto's is that it's an immune system dysregulation that causes inflammation and attacks the thyroid gland. And unless you do antibody levels for the thyroid markers, you're not going to get the answer, because you can have absolutely normal thyroid labs, TSH, T4, T3, but have Hashimoto's. It just depends when you test, because the TSH fluctuates quite a bit.
Right.
So the thyroid antibodies are primarily thyroid peroxidase antibody, or TPO, and antithyroglobulin antibody. Out of these two, probably TPO antibodies are the more common ones that show up. And they're really pretty inexpensive to do most of the time. So it's something that should be routinely run on anyone that is coming in with general symptoms that they can't figure out: fatigue, GI symptoms, brain fog, just general menstrual symptoms, things like that. If there's a lot of symptoms, especially in a young female, that's a test that should be done across the board without thinking twice.
That's awesome. So we need to advise patients who maybe think they have some symptoms of Hashimoto's, but haven't been diagnosed, but they're still struggling with weight gain, fatigue, brain fog, to test their TPO antibodies, test maybe thyroglobulin antibodies, like you said. And for anyone listening who, who doesn't understand thyroid health, can you like let them know, like, what does a high TSH mean? What does a low TSH mean? What does not enough T4 or too much T4, and what does that conversion irregularities look like? And just explain kind of more that in a simplified version for some people, maybe.
Sure. Yeah. So Basic thyroid physiology is that the TSH is going to be released from this pituitary gland, which is in your brain, and it goes down to your thyroid gland, and it promotes the production of thyroid hormones. Once that TSH signal comes in, you produce T4 and T3 in the thyroid gland. Primarily, you produce T4. Most of the hormone is T4. But when you go peripherally in different tissues in the body, the T4 then gets converted into T3. Okay, so T3 is the metabolically active version of thyroid hormone that then goes to all the cells and causes your thyroid hormones to function. So that's when you're talking about the conversion, you're talking about converting T4 into T3. Some people, when they have Hashimoto's, have a problem with that conversion. And so they can have a normal amount of T4 coming in, but they have too little T3. And they may require T3 as a exogenous hormone being given to them. Other people may require T4. It just really depends on your situation. But the point is that those are your thyroid hormones. And then they go back and they have a negative feedback loop with the pituitary gland to either raise your TSH if you're not producing enough thyroid hormones, in which case your TSH is high, and that indicates hypothyroidism. So it's kind of a counterintuitive if you think about it, right. But it's a negative feedback. So when your TSH rises above 4.5 in that range, that's when you're talking about developing hypothyroidism. That in conjunction with a low T4, low T3 will indicate low thyroid function. And conversely, if you have high T4 and T3 for whatever reason, if you have Graves' disease, which is another autoimmune condition affecting the thyroid gland, but in this case causing hyperthyroidism, or whatever the factor might be, too much thyroid hormone. If you have too high T4 and T3, then it's going to shut off your production of TSH in the negative feedback loop. So you're going to have low TSH. So it depends where you are on the scale. But it's important to not just test for TSH, but also T4 and T3 levels.
Definitely. Do you ever test for reverse T3?
Yes. So reverse T3 is another marker to test for. Reverse T3 is basically when your part of your T3 hormone, that is your active hormone, part of it goes into reverse T3, which is metabolically inactive. It's almost like a brake pedal for your thyroid gland. It's a mechanism where it can shuttle some of that excess T3 into reverse T3. But some people can have too much reverse T3 and have issues with low thyroid because of chronic inflammation, because of stress, because of pathogens, things like that can cause too much T3 production, reverse T3 production. So when you know that, you may need to work on that situation and try to decrease that pathway conversion.
And thyroid health, it seems complicated, right? Especially if someone who's just doing the labs on their own. So of course, from everything you said, we need to go see a practitioner to get these markers evaluated correctly. In your opinion, Doc, what are the things we look at? If someone's got, maybe they have high TSH, some conversion issues, maybe they do have Hashimoto's, should we also look at the guts or liver health? And how do you look at that in your practice?
Yeah, so the main thing I try to tell people is this point that Hashimoto's is a multi-system inflammatory condition, and it really needs to be treated as such, which means that it affects virtually every system in the body. And I'm not talking just about like hypothyroidism, because hypothyroidism, yes, it also affects many different organs, because you need good thyroid levels for, let's say, gallbladder function. You need good amount for the motility of your GI system. All of this can be affected if you have hypothyroidism and it's untreated. So you do need to be on thyroid replacement for that. Now, with Hashimoto's, the point is you can be on thyroid replacement and you still have problems in various different systems, because there's an inflammatory cascade, inflammatory issues going on that affects your brain, causing brain fog, fatigue, cognitive issues. That can affect your GI system, cause intestinal permeability issues, cause SIBO or bacterial overgrowth. It can cause immune system dysregulation. Even when you talk about liver and liver health, so it can impair detoxification pathways. So it affects female hormones in that system. and and so many other systems. And so it's just important to, understand that it depends on what the patient is coming in with, in that you have to look at what else might be going on with them.
Right. And so in your opinion, is Hashimoto's, is it a genetic factor, or is it lifestyle and genetics together? And what are, because I know we're not born, some people are, but we're not born with, a thyroid. We're not born with hypothyroidism, right? There's there's a lot of different factors that play into that. What are some of those factors that, in your opinion, that can maybe be prevented or minimized for maybe someone who's younger, who maybe has a history in their family of, thyroid disorder or disease? What can they do to start maybe making proactive steps to prevent that later on in life?
Yeah, so it's basically the latter. It's a combination of your genes and your environment, which is the case for all autoimmune conditions. There is a genetic predisposition, but when we're talking about genetic predisposition, we're talking about a set of different genes coming together and laying the groundwork for what can develop in your life if they're the right environmental triggers. So it doesn't resign you to having the illness, to having the autoimmune condition. Now, there are some genetic conditions that if you have it, you're almost 100% sure of having that. That's a very small segment of the conditions, the chronic conditions we're talking about. But in this case, it's more of different genes, and they predispose you to various conditions and some sort of environmental trigger. For some people, it can be a major stressful event. It could be a dietary trigger. It could be a pathogen or some form of inflammation that has turned on those genes. So it's always a combination of genes and environment. I want to make very clear to people that they don't feel responsible for their autoimmune condition, meaning they don't feel like they've caused it from something they've done. Okay. So, we want to make sure that we're not like shifting blame on anyone, where it's like, you could have, if you did this, you would have prevented it. But generally, yes, there are, just by trying to live an overall healthy lifestyle, focusing on diet and minimizing processed foods and just having a more cleaner, healthier diet, and all those aspects of lifestyle that we all know, but we just have to keep reminding ourselves, which is sleep, stress management, exercise as much as possible, or as much as tolerable. And so if you do these, you can give yourself the best chance of making your genes work for you as opposed to against you.
Right.
So yeah.
Yeah, thank you for that. I think that makes so much sense. Yeah, because what do they say? Genetics load the gun, but your environment pulls the trigger. So
exactly, that's a good saying.
And so, with that being said, and you mentioned a lot of different things that we all know we should exercise. We all know we should eat better. We all know we should sleep better. What is one of the biggest levers of lifestyle medicine that you want to pull first when the patient comes to you and they have Hashimoto's? What is one, if you say, hey, if you can only choose one of these three, what would you choose first, and why? And especially because everyone's got time issues and financial issues. What is something easy to focus on?
It would be between diet and sleep, I would say.
Okay.
And I say that because different situations may account for you would focus on diet versus to focus on sleep. Now, in the case of sleep, we know that good restful sleep modulates your immune system in a way in which you're more likely to benefit the immune system and less likely to have a flare up and just a benefit in your condition overall. Whereas poor sleep can do the opposite. With diet, if someone is at a stage which is early on and they haven't made a lot of dietary changes, there's a lot of things that we can try to do to either eliminate certain groups of foods or bring in certain foods that can help them in determining their particular sensitivities and their particular foods that they don't tolerate well and that their immune system doesn't like well, and just give them the best overall health. So if someone is generally sleeping well, but they're coming in eating a poor diet, processed foods, fast foods, things like that, then we'll try to focus on the diet component. Whereas someone who's had a lot of experience with their illness may have a lot of the dietary triggers taken care of, and then we focus on other things. So, but those two are two key factors.
So sleep and diet for sure. What are some consequences for someone who maybe goes undiagnosed with Hashimoto's for 10 years? And what if there's a higher number of TPO antibodies? Does that necessarily equal more inflammation? What are your thoughts on that?
Yeah, that's a great question. So it's important to understand that higher antibody levels doesn't necessarily correlate with worse disease. And I say that because your antibodies don't itself cause tissue destruction. Your antibodies mark the thyroid tissue, and then your T cells will come and do the actual destroying of the thyroid gland. So what that means practically is that you can have an antibody level of 50 or 100 and feel terrible if you have, other factors that are going against you in the immune system, and you can have an antibody level of 600, 700 and feel much better. So it varies from person to person and what other situations are going on in the immune system. But why antibodies can be beneficial is that A, it helps to diagnose it, obviously.
Sure.
But B, once you have that baseline of what the antibody levels are, you can track your own overall illness and say, my antibody levels improved or they got worse, things like that. And that can be a general marker to what's better. But what you can't do is really compare antibodies from one person to another and say, well, so-and-so has, such a high antibody, but feels much better. And I have very low antibodies, I feel worse. It's just much more complex than that.
Is there consequences, though, to being left undiagnosed or untreated for 10 years to the thyroid gland in particular?
Yeah, so if you're undiagnosed or untreated, now first, you're going to have progressive destruction of the thyroid gland over time. So your need for thyroid hormone will arise and increase more and more. So that's going to be the number one thing. And number two, you're going to have unchecked inflammation going on, and you're going to be basically going from provider to provider, looking for answers, looking to get better, fatigue and weight gain, and all sorts of things could happen. And if that's the case, then you just won't get the answers that you need. And so left untreated, it can be very difficult to deal with. And there are a lot of people in various Facebook groups and things like that are just looking for better answers, and they don't have that out there, in both in terms of explanation and in terms of treatment options. So I think that it can be very bad left untreated. So it's really important to try to look into the deeper causes and get there.
Awesome. And so another question, answer this how you wish. Does every person who has Hashimoto necessarily need to be on a thyroid replacement prescription?
No. If the Hashimoto's and thyroid, underactive thyroid, are two distinct entities. So in time, yes, there's a possibility that you might need to be on thyroid hormone replacement because of enough destruction in the thyroid gland has occurred. But there's a lot of people with Hashimoto's with normal thyroid labs. And so what's important to understand is that you have to look in and of itself if you have hypothyroidism or not. If you do have hypothyroidism, then yes, it's important to be on thyroid replacement. And why I say that is because a lot of people are against medications in general and thyroid medication specifically, let's say. And what they have to realize is that you can do all the diet, lifestyle, supplements, whatever you'd like to do, but unless your thyroid is functioning at a good level, it's going to be very difficult to have those changes and symptoms that you're looking for, because the thyroid hormone is so important in regulating metabolism in every cell of the body. So not everyone with Hashimoto's has to be on thyroid replacement, but everyone who is hypothyroid should be on thyroid replacement.
Yeah, thank you for clarifying that. And is there ever a situation where a patient maybe goes on a medication for thyroid replacement and eventually starts doing everything you told them to do? They're doing the sleep, they're doing the lifestyle, they're doing the supplements, everything's going in the right direction, the stress levels are maintained. Is there ever a situation where a person can get off thyroid replacement and regain normal thyroid function again?
Yeah, absolutely. And so there are many instances, and I think this is one of the problems that does arise in functional medicine, where people are prematurely put on thyroid replacement. So you have situations where you're going in to see your physician and your TSH level is, 3.5, something like that, and you have some fatigue, you have some hair loss, you have some a few gut issues, things like that. And automatically the thyroid gland is blamed for it, and you're put on thyroid replacement,
Right.
a type of thyroid replacement. In my mind, that is more of a, it's not the best approach, because it's not overt hypothyroidism that patient has that requires them to be on thyroid replacement. Rather, it is a situation in which something else is going on, be it their GI health or some other health, and that is causing some thyroid related numbers to fluctuate. So it's really important to have a good threshold with which you would start someone on thyroid replacement, because some people will start on thyroid replacement, initially feel better, and then feel worse. And so my goal with some of the patients is to, especially asking them how they were diagnosed. So if they were diagnosed with numbers that you look at and you go like, well, this isn't really hypothyroidism, then those are the patients that I would try to work with to get off of thyroid medications. And some of the studies show that probably about a third of patients that have that are on thyroid replacement can successfully come off of it with no symptom issues and normal labs. That's
awesome. Great to know.
Yeah.
And just for anyone listening, I maybe it's more from my own personal knowledge is what I'm a chiropractor. I never got to prescribe medications. I was more the natural route. But what is Synthroid? What is Armor? What are some of the differences in the medications themselves? Because I know some of those are more bioidentical, and maybe someone who knew that would maybe be less scared to take one of those medications if they need to so.
Yeah. So Synthroid or levothyroxine is more of a synthetic thyroid hormone that primarily contains T4 as opposed to T3. So when you talk about thyroid hormone replacement, you're really, people feel very, very strongly about this, because, they kind of get really, married to kind of one thyroid hormone replacement. And it's like, I use Armor for everyone. I use levothyroxine for everyone. So what ends up happening is, generally speaking, the conventional world and endocrinology, everyone like that, is using Synthroid or levothyroxine, the synthetic form, and people in the more natural medicine world are using the natural ones, Armor Thyroid, things like that, Nature Thyroid and stuff. For me, there's really no, there's no right or wrong, because different people can react differently to it. Some of the ingredients in the Synthroid, the fillers and things that they have, may not work well for someone, but may work well for someone else. So I think that thyroid hormone replacement should be looked at as part of the puzzle, but you shouldn't put all your eggs in that basket of, I need to find the right thyroid hormone for me and stick to that, because it's just much more complex than simply getting on the right thyroid medication and then feeling better for the rest of your life.
Right.
So a lot of people will go, they'll start with Synthroid and they'll go to something else and they'll go to something else, and they'll feel better for a bit, but then not feel good after that, and try to figure out why. And the reason is because the answer doesn't lie entirely in thyroid hormone replacement.
Yeah.
So, yeah.
I have an analogy that I like to use for testosterone in men, and basically usually men will start to get these symptoms of fatigue and gaining weight. Maybe it's losing hair, maybe it's low sex drive, and so they go get tested for testosterone, and lo and behold, it's low. And so they think the answer to all their issues is getting on testosterone replacement, and they think, but if you really look at their lifestyles, hey, you're not sleeping at all, you're not exercising, you're stressed out to the max, right? You're drinking alcohol every night, you're doing all these lifestyle factors that are totally probably causing that low testosterone, but then they think just getting on testosterone is going to fix everything. Is that a similar analogy to maybe to thyroid in some regards? That hey, it's more than just the thyroid, it's more than just the a band-aid symptom.
Yeah, in some ways, I think the analogy definitely works. I think that maybe the mechanism is different when you're talking about Hashimoto's and inflammation and everything, but you're absolutely right, where it has to be a two-pronged approach, which is or a multi-pronged approach where you're replacing thyroid hormone adequately, but you're also taking care of everything else that worsens Hashimoto's. And that's really why you have the issues around this, where a lot of people go to their endocrinologist and they'll be on the right medication and they will get their labs drawn and their labs look absolutely fine. They can't figure out why they have fatigue, why they have all these other symptoms. And that's a side where you're just focusing on the medication and not really looking at anything else. And on the other hand, you can have a situation in which you're doing everything else right, but you're hypothyroid pretty obviously, and you need to be on replacement, but you refuse to take that medication. So there's problems with both sides. And I think a balance is needed, and you're not going to get better if you just use one.
So it's a whole body approach. Hey, yes, your hypothyroidism. Let's get you on a medication that works for you. Find the right dose. But let's also address everything else that you mentioned: lifestyle, sleep, the diet, managing stress, all those things. And let's marry those two together in the best way possible. I do want to talk about supplements, but before we do that, I want to ask you about specifically more diet recommendations. That I hear a lot of different things in the communities around being gluten-free. Some people say we got to be gluten-free for everything. And I've heard some really good things for being on a gluten-free diet with Hashimoto's in particular. Do you have any thoughts on that, on being gluten-free for Hashimoto's?
Yeah, so I know it's very popular to be gluten-free now. And so, I try to use it against everything in a balanced way, where we don't need to, fully villainize gluten for every single person, but we do need to understand where it causes problems. And one of those problems is in Hashimoto's and the phenomenon that's called molecular mimicry, where your gluten molecule resembles your thyroid gland molecule very, very closely. And so when you do consume gluten, you can get a thyroid reaction and not feel well overall. When you do consume gluten, your intestinal permeability can suffer, and those tight junctions can open up in the intestine. You can have immune system activation more so that way. So I think for someone who is struggling with Hashimoto's, going gluten-free is definitely worth it, because for some people it can be a big, big game changer. And so it is worth trying. For other people, it may not have that significant a difference in their life. And if that's the case, then they can find a way to maybe have some gluten in their life. But I think that just aiming for an overall health, like a diet, a good diet approach to Hashimoto's, and then also trying gluten-free is important.
Yeah, and if someone has Hashimoto's and they go gluten-free, do they have to be gluten-free for life? What happens if they get glutened or they go out to a restaurant and they eat gluten again?
Yeah.
Do you have any remedies for that?
Yeah, it's a tough one, because when you're talking mechanistically, yes, you do have to be gluten-free. It's an all or nothing thing, because if you do even have a little bit of gluten, that will disrupt the immune system. And so that's from a mechanism perspective. But what we have to be very careful about is that when I talk to people in real life situations, with a ton of struggles and a ton of things that are difficult. And so just saying to someone like never have gluten again may not be very practical. And so you have to understand people's, sometimes you may cause more harm in trying to get someone to remove something from their diet, because that comes at the expense of a lot of social engagements, a lot of maybe going out to eat, which is a big source of family connection, friend connection, overall happiness. So we want to be careful to not put people in a situation where their stress is increased around diet and dietary recommendations. But at the same time, we do want to understand the mechanism around gluten and how that can affect you.
Yeah, I think I'm right with you. Just with the molecular mimicry with Hashimoto's and gluten, there's a lot of studies behind that. But also, at what expense do you avoid it at all costs? Because you're not going to go out to eat. You're going to live in a bubble. You're going to stay at home, 24/7. There's got to be a balance. And I think also just being resilient too. Use an enzyme where necessary. But if you've done the protocols like you've taught, and they go out to eat maybe every once in a while, maybe it's not as bad of a trigger as it could have been, because they have everything else working optimally. And so with that being said, I want to talk about supplements, and what supplements that you recommend for, I guess, general health, more foundational health, but also the things that you work more specifically for thyroid health.
Yeah, so foundational health, if you're, vitamin D is one we've talked about quite a bit. Magnesium is very important because a lot of people are deficient there. Your omega-3 fatty acids are going to be very important. Those are kind of key foundational ones. And then if you're talking more specifically on Hashimoto's and the immune system, there are selenium is another one that's been shown to decrease antibody levels. Vitamin D, like I mentioned, is significant for Hashimoto's because a lot of people have vitamin D deficiency. Myoinositol is another one with Hashimoto's that can be very beneficial. Glutathione is an antioxidant that gets depleted in a lot of the mechanisms around autoimmunity and Hashimoto's. So using glutathione or NAC to boost up antioxidant levels. You can use short chain fatty acids as well. Short chain fatty acids like butyrate are compounds that are produced by the good bacteria in our gut, and they have various immune modulatory effects. So they benefit the immune system. So that can be either gotten through your diet or it can be gotten through supplement form. Trying to see if there's any more specific, obviously zinc in the immune system can be very effective. So there are certain things that will be just beneficial from an overall immune perspective and certain things more specific to Hashimoto's.
What are your thoughts on iodine and Hashimoto's? I know there's a lot of controversy where some practitioners, yes, we need iodine. Some people say, hey, it's like kind of putting gas on a fire.
Yeah.
What are your thoughts on that? And I'm asking out of curiosity.
Yeah, it's a really important topic. It's a really difficult topic because I think a lot of people are in one camp or the other. Have the research that I've seen and the kind of a lot of the mentorship I take from like people like Dr. Karazian, who is pretty high up in the world of immune system or let's say immunology research and Hashimoto's specifically, and also deals with patients on a practical basis with it, recommends against iodine in patients both in supplement form and in dietary form. So iodine restriction has been shown to be more beneficial than iodine supplementation. Now, when you talk about overall thyroid health, iodine is an important supplement that is a mineral that helps in thyroid hormone formation. So when you talk about thyroid health in general, it's good to take iodine. But if you have Hashimoto's, iodine supplementation can cause a flare-up in a kind of a counter reactive way. So you want to limit iodine usage.
Okay, I really appreciate that. All right, so is there any other supplements that we missed that maybe will be beneficial, or maybe someone who's trying to get off, or maybe someone who's subclinical hypothyroid? Yeah. What are some supplements that you recommend in addition to what you already mentioned? Is there any that come to mind?
There isn't necessarily if someone is subclinically hypothyroid, you want to figure out why that's the case. A lot of time that might involve your GI system, and there might be some GI disturbance there. There could be some dysbiosis going on. There could be SIBO or bacterial overgrowth going on, intestinal permeability, these types of things. So you want to try to get their digestive health in the best position possible. And when you do that, then you may repeat the thyroid numbers and it gets better. So it oftentimes goes back to the foundations and the fundamentals of diet, lifestyle, and GI foundational health, and then see the numbers from there. In terms of focusing on the thyroid health, it's the same ones that we talked about, a lot of vitamin D, selenium, iodine, as far as just trying to get those minerals and cofactors that help thyroid hormone function.
Awesome. Thank you for that. So this has been an amazing conversation, really informative. Really, I love how you simplify thyroid health and the function and the physiology behind thyroid metabolism. So anyone listening to this, take another listen, because Dr. Akhter really explained it very well. Dr. Akhter, I want to ask you for personal questions. So let's get fun with this. I'm going to put it in gallery mode for anyone watching online. But so Dr. Akhter, if you had to put a billboard up in your hometown or back home, and it could say anything health related, one or two sentences or a couple words, what would you want people to know and why?
I would say that there is, I haven't thought of the exact wording of this, but I'm kind of, exactly what I want to tell people is that there are better ways to address their chronic disease. And I say that because a lot of people have a lot of people end up losing hope in the medical system because they've seen a practitioner or they have, been to so many doctors and not gotten answers. They're still struggling and they feel like, the medication isn't helping them. They feel like the approach isn't helping them or giving them the answer. They feel like they're not heard. And so I want those folks to know out there that if they have chronic symptoms or a chronic illness, that there is a better approach, a more holistic approach. So that's what I would try to put in one line.
Awesome.
There is a more holistic, better approach to chronic illness.
Yes, there's a better way. Love it.
Yeah.
Love it.
Yeah.
Okay. If you had to put, or if you had to take something health related, a device, gadget, biohacking tool, whatever you want to call it, on a desert or deserted island with you, what would you take and why? And what would be your number one thing or reasoning behind it?
Would this be supplement specifically?
It can be. Yeah, I've heard that whatever you want it to be. It's been supplements in the past. But I want to hear your answer.
Yeah, so it was a great question. I think, so I can answer that. Supplement wise, I think it's a tough one because there's so many good ones and then also condition specific. I think that because of the broad array of what it can provide, maybe magnesium might be the best to take, just only because it can do so many different things, from stress relief to your GI system and things like that. So magnesium would be one. Vitamin D would be another, because we're finding more and more about the immune functions of vitamin D. So it would be a close between those two for me.
We think exactly alike, because my answer is always magnesium. I guess I cheat and I say, hey, I'm probably gonna get vitamin D from the sun on this island, so that's going to negate that. So yes, we're right on the same wavelength as far as that goes. Dr. Akhter, is there any questions, if we can reverse roles and you're interviewing me and you're asking me about thyroid health, is there anything that I missed that you want more of the viewers or listeners to know about thyroid health, or in particular Hashimoto's?
I think, the type of stuff that you're doing where you're just bringing this more to the attention, and also talking to folks like myself who are trying to take a balanced approach. I think that's the key thing. We want to try to bring in opinions from people in the middle more so, because too many of the times you hear opinions from either side, which is, maybe a lot of the natural medicine side, and that ignores a lot of conventional medicine, and then the conventional medicine side that ignores a lot of natural medicine. So I think taking that balanced approach and trying to have conversations with people that is giving viewers a both sides is very important. So I appreciate you doing that.
Yeah, of course. I really like how you said that, and I agree wholeheartedly with you. It should be a balanced approach, and we shouldn't, be fighting each other all the time. There's solutions to everything, and there's got to be some common ground. It's not politics in healthcare. It shouldn't be that way. And I think I'm going to name this podcast "A Balanced Approach to Hashimoto's," because that was perfect.
That's a perfect name. Yeah,
that's a perfect name. So that's actually, thank you for that. We're going to name this podcast "A Balanced Approach to Hashimoto's" with Dr. Omar Akhter. Dr. Akhter, this has been an amazing interview, and you've got me on fire to do more podcasts, because this is so informative, and I love getting information out like this to the masses. Dr. Akhter, where can people find you? Where can people find your podcast, your website? Do you take telehealth patients? And let everyone know where we can find you at.
Yes, so my website is www.medina medicine. That's MADINA medicine.com. That contains all the contact information if you want to get in touch. The podcast is called Better Medicine, and that's available on iTunes, Spotify, and all the other the podcast platforms. It's basically just talking to people in this type of fashion, where I'm trying to look for better ways to address chronic disease and different interesting topics. And so that's been really fun. And yeah, so I'd appreciate if people could listen to that.
Awesome. And do you take telehealth patients, or do you need to be seen at?
No, I do take telehealth patients, but they have to be in Texas at least to establish. So telehealth patients anywhere in Texas I can see. If they happen to then move to a different state, then it's just once a year that they have to come back into the state. But that's really the only limitation.
Perfect. Well, Dr. Akhter, thank you so much for coming on again today. I really appreciate it, and I look forward to speaking with you more in the future.
I appreciate it. Thanks, Robert.
Thank you.
Thanks for listening to the Fredrickson Health Show. This podcast is for educational purposes only and not intended to be used as personalized medical advice. Be sure to subscribe to this podcast so you don't miss a single episode. While you're at it, leave us a rating and review. Follow us on social media and subscribe to our email newsletter for more information.